Hi everybody, it's my great pleasure to be here to talk with you about Quickset for different indication and particularly for hip avascular osteonecrosis. My name is Sébastien Parratte. I'm professor of orthopedic surgery in Marseille, France. I'm working mainly in hip and knee surgery, in trauma and reconstruction, and I've been using Quickset since 2010, and we have in the department a great experience with the product. The subject of the talk today is to talk about the use of Quickset and bone marrow concentration for the avascular osteonecrosis of the hip. The rationale is based on many studies, and particularly the study done in France by Philippe Ernigout and his team in Paris about the role of the bone marrow cells to repair the lesion of osteonecrosis, and particularly in the hip. Our hypothesis was that hip decompression combined with progenitor cells injection and bone void filling with Quickset will be able to maintain the cells in place, avoid bleeding, and optimize the healing of the lesion. The basic of the technique is that we're going to harvest the cells on the homolateral iliac crest of the patient. We're going to proceed to the concentration of the cells. Then we're going to perform the femoral neck drilling, the decompression of the AVN area, the cell injection, and then replace the cancellous bone and inject the Quickset at that time. So we're going to start with a case. This patient was a 20-year-old patient, and he came for an avascular osteonecrosis of the right hip secondary to a treated lymphoma 2 years before. When he came to the consultation, he was feeling permanent pain. He was unable to walk, and we didn't saw any evolution after a limitation of weight bearing or biphosphonate treatment. So we decided to go for surgery, and you can see the case, and you can see the osteonecrosis on the MRI. You can see on the Arthrex CT that there's the osteonecrosis lesion, and you can also see that the cartilage is still there. So it's a perfect indication because there's no lesion or damage of the cartilage. It's a purely bony lesion. So the patient setup is very standard. On the traction table, we are using fluoroscopy with a vertical field to be able to obtain some AP and ML view of the neck and of the head of the patient. So the step one is first to harvest the bone marrow from the iliac crest on the homolateral side of the patient, as you can see on this device, as you can see on this slide, with the GEMCD trocar. The idea is to harvest around 60 milliliters of bone marrow at this stage, and then we are using a concentration device that at that time of the study was a device that was available to us, but Arthrex is now launching the Angel device, and we're going to start to use this device in our current practice to concentrate the cells. The step two is to position the wire on the femoral neck of the patient. You can see that we are doing that under fluoroscopy to control and to make sure that the wire is properly positioned on the AP and on the ML view to reach exactly the lesion that we want to treat. The step three is the drilling. It's very important to drill the lesion, and once again, at that time we were using a kit that was available for us, but Arthrex is launching a new drilling kit that will be optimized for this type of indication, and we're going to start the use of this kit very soon. So you can see that it's a manual drilling, and this is very important to avoid eating of the bone in the neck and, of course, in the area of the lesion to make sure that we will not create some lesion there. So you have to go very slowly to control that, once again, on the ML and on the AP view of the fluoroscopy. Then it's important to harvest the cancellous bone that you can obtain when you are drilling, because this is going to be helpful at the end of the procedure, as you can see. The step five is the insertion of the cannula that is going to be used to inject the cells exactly where we want to inject the cells. So to do that, we insert once again the cannula under fluoroscopic on the ML and on the AP view. Then the step six is very important. This is the injection of the concentrated bone marrow. To do that, the first things to do is to play with the position of the table. Why? Because you're going to incline the table to play with the gravity to maintain the cells, which are in liquid form, into the femoral head of the patient, as you can see on this short schema. So we are injecting the cells there, and then the step 7 is to reposition the harvested Cancellous bone before. So you can see that we are playing with the bone and we are bringing back the Cancellous bone there, and it's very important to put that back because it's going to maintain the cells without too much pressure and without pushing too much this Cancellous bone into the head. The step 8 is then to use the Quickset to inject and to maintain and to fill the bone void that is remaining after the drilling of the neck. In fact, it's very important to treat the lesion, but it's also very important to reinforce and to maintain the balance into the femoral neck. Usually, I'm using between 8 and 16 cc of Quickset. I'm injecting the Quickset without any pressure. I'm performing a retrograde injection under fluoroscopic guidance, of course, as you can see on this slide. You can see for this patient the postoperative control. You can see on this control that there's a bit of product of Quickset into the soft tissue. If you get that, it's not a problem at all. Why? Because you're going to see that at 6 months, there's absolutely no more product anymore into the soft tissue of the patient. You can see the control at 1 year for this particular patient. You can see that there's absolutely no more Quickset into the soft tissues. You can see that the integration of the Quickset is very good on this AP view and on this ML view as well. You can see that the lesion is treated and it's regenerated, and you can see a perfect integration and interpenetration of the product into the Cancellous bone of the patient. Clinically, this patient is feeling normal. So, in conclusion, this system is simple and easy. Furthermore, Arthrex is going to launch first the Angel system for the bone marrow concentration and the drilling kit, and both combined together will make this procedure even easier, even safer. We have an ongoing study to evaluate the mid and long-term results of this combined procedure, but there's very promising result for the 1-year follow-up. And we are, of course, keeping on treating this young and healthy patient that need everything to avoid total hip arthroplasty before they're 50 at least. Thank you very much for your attention.